Talk about the difference between acute inflammation and chronic inflammation. Specifically, you talked about acute inflammation. Now we're seeing research and studies, and there's a big debate even within this. But talk to us about the acute inflammatory response.
Sure.
And then maybe we'll dive into a little bit of that chronic inflammatory response and the difference between those two.
Oh, sure. And I think to me, this is where orthobiologics come to play, right? So acute inflammation is mitigated or caused, acute inflammation is started in your body by a molecule or a cell called a platelet, right? So the platelets are these little cells that float around through your bloodstream. They hang out with the red blood cells and the white blood cells. But when there's an area of injury, the body sends, like let's say you cut your hand while you're, I don't know, picking up your golf tee. I don't know, whatever you're doing. And let's say you cut you. If you do that, you probably shouldn't be on the golf course. But if you cut yourself and you get that, like a day or two later, it's a little red, a little swollen. That's acute inflammation, okay? Red hot on fire. What's happening is the body is, through the bloodstream, sending platelets to the area of injury. Platelets rupture open their membranes. Inside the platelet are a whole bunch of things called growth factors and all these other substances, but we'll just call it growth factors. I like to think about it like fertilizer. So you've got all this fertilizer, and the platelets then go to the area of injury and tell the body, this area needs help. The body then sends stem cells and other healing cells to the area of injury. They attach to the injured tissue. They heal. So acute inflammation is essential. Now, acute inflammation improves, let's not go with the cut anymore. We're talking about a tendon. You've been canoeing and your elbow is sore. It hurts to move it. It just started. So usually an acute inflammatory reaction can last up to, I tell people, well, once you get out, you can go 4 or 5 weeks. But when you get past that, the body just gives up. It's been trying to send platelets there. It's been trying to cause acute inflammation to attract in everything it needs to heal. But then after a certain period of time, it's sort of like your body has so many firefighters, and they're like, hey, I got better things to do. And that tissue then goes from an acute inflammatory reaction, red hot on fire. The body then is like, okay, I can't heal it with these platelets. So it starts to lay down something called ground substance, which is abnormal collagen. And abnormal collagen is weak. And abnormal collagen then can easily be injured, torn, and cause pain.